The first delegation comes from Jimmy McLean, Gift from the Heart, Community Engagement Liaison. Sir.
Thank you, Mayor Ostrander and Council. Today, we're going to answer 5 questions: what, who, why, how, and when. Question number 1, what are we discussing? Well, tonight we're going to be talking about what Gift from the Heart has already accomplished and the impact it has had in the Bay of Quinte and Brighton, and outline our plan to affect change with those who need our help the most. Question number 2, who are we? Well, Gift from the Heart is a Canadian nonprofit charity finding solutions to accessing emergency and preventative oral health care for the underserved members of our community. But this is also who we are. Meet Courtney, owner of the Boardwalk Burgers here in Brighton. This entrepreneur has struggled with oral health care her whole life. Through the dynamic relationships and common goals and values of many in our community, we've been able to create a success story that has tangible ripple effects felt well after Courtney sat in our chair. Can you believe that there is a business owner who cannot afford or did not have access to adequate dental care? We are here to dismantle the preconceived notions of who the underserved are and who it is that are accessing charitable programs in our community. Why we do what we do? Well, in order to let you know that, we need to tell you about the problems that our community members face. Geographical location. For those who live in urban areas, they can take for granted the kind of access to care that they have. For 18.9% of the population who live in rural areas, we aren't so fortunate. We believe our community members really resonate with this statistic. Unwilling subsidy participants. An increasing number of dental offices are unwilling to accept patients with ODSP and OW, and likely the new program being put in place stating they lose money or it's not profitable. Fear. Previous experiences leave permanent scars. There's also social stigmas associated to those without access to dental care. Asking for help is admitting there is a problem, and for some, that is difficult to do. Lack of finances. They do not have dental insurance, or their coverage is nowhere near the threshold necessary to finance some of the most basic needs. Examples: 2 cleanings and a filling or tooth extraction over a calendar year. For those who are able to use what little they have, those procedures are almost always surgical and restorative, leaving no money for the most important one, preventative. To put problems in perspective, have your gums ever bled? How many people are not flossing because of discomfort and inflammation? If you had a cut on your arm that consistently bled, would you just leave it? Bleeding gums are one of the most common symptoms anyone can run into, but are overwhelmingly ignored because of the dysbiosis of bad bacteria in your mouth is literally screaming for help. This is where a Provora treatment from Gift from the Heart can start to help members of our community, not just today, but tomorrow and the next. Question number 4, how do we provide solutions? Well, how do we provide solutions? Well, we have a target audience, and our target audience is to provide treatment for all underserved members of our community. Again, we're here to redefine what underserved means. But some examples include seniors and retired, especially those with concerns about frailty, diabetes, heart disease, and dementia. Limited or no finances available for the required emergency care. No access to ODSP or OW. And this is the big one, the working poor. These are the people who are working but have no benefits, or their benefits are not enough coverage for their required emergency care. And then we also have our outreach dental clinics. In true entrepreneurial spirit, Gift from the Heart has created a unique design to providing oral health care to the underserved members of our community. Right here in Brighton, we have our outreach dental clinic, which is currently operational. In the Bay of Quinte at Loyalist College, we have a mobile outreach clinic that is currently operational. Those implications are, the implications with that being we can literally take this clinic on the road and set up where our help is needed the most. And this has now also become a working template that can be replicated. In addition, Gift from the Heart is being proactive by offering this life-saving product to those who need it the most, the underserved members of our community. The typical patient gets their teeth cleaned 3 to 4 times or more a year. These costs alone are in excess and out of reach for many in our community. Provora would cut down cleanings by 50% or more freeing people from pain and freeing up space in our dental chairs and emergency rooms. But what is Provora? Provora is a chlorhexidine-based product. Chlorhexidine is an antiseptic used to sterilize for pocket surgeries and in healthcare practice to reduce pocket depth and periodontitis and to treat gingivitis. It helps to eliminate bacteria, which leads to the dysbiosis, which leads to the inflammations. This is where the gums become loose and flabby, thus creating the room for tartar and calculus to build up, becoming hard deposits, so on and so forth. But who historically uses Provora? People in long-term care facilities, people who have suffered heart attacks and strokes, people who have diabetes, people who are going through cancer treatments at hospitals like Prince Margaret, Toronto General, and Sunnybrook. Why is it used with these specific demographics? Well, they have a common symptom, a lowered immune system. Without Provora, the dysbiosis of harmful bacteria impedes on the success of the treatments being administered. With Provora, you lower harmful bacteria that originate in the mouth up to 60 to 80%, which helps to heal the rest of the body because whole body health starts in the mouth. And some of the value gained, when we want to provide examples of the work being done in Brighton and BOQ, we have created outside the box dental office ways to provide quality oral health care to our residents that they can afford. To date, Gift from the Heart has provided up to $24,000 in surgical extractions, almost $17,000 in restorative care, and almost $14,000 in preventative care. This is almost $55,000. And this is since November, since our outreach mobile clinic became operational. The takeaway, only 25% of the work that we are doing is getting to the root cause, but through continued community engagement and creating sustaining oral health awareness in our community and your continued support, Gift from the Heart are helping people get out of pain and, more importantly, helping to ease the strain on an already overburdened healthcare system. Together, we can build your immune system and our community. And when are we going to help? Well, before I answer that, let me tell you about what's next. We just had our oral health awareness night in Belleville with the Belleville Senators. That kicks off our aggressive oral health awareness campaign, which will help to expand our footprint in Brighton and the Bay of Quinte. We are introducing the benefits of Provora, and we're also creating and sustaining dynamic relationships with other community caring organizations. And this is all ramping up to the fundraising event we have in September, the Amazing Race 2024, showcasing commerce, community, and smiles right here in Brighton. So to answer the question of when are we going to help, the answer is yesterday. That said, we wanted to reinvigorate oral health awareness in our community and let the Municipality of Brighton know that these are just some of the initiatives Gift of the Heart has for the Bay of Quinte and for Brighton. And to conclude, we'd like to thank the Municipality of Brighton for their continued support and once again invite City Council to continue to be champions for Gift from the Heart by creating a safe place for information and collaboration. We will continue to find solutions to accessing emergency and preventative oral health care for the underserved members of our community. Thank you.
Thank you, Mr. McLean. I'll open the floor to questions of clarification from members of council. Seeing none, that tells me you did a good job.
Thank you.
Thank you. And I understand you want a photo.
Actually, we thought that if there was notification of the check presentation.
We'll do it then.
We'll do it all.
Perfect. Yeah.
Okay, thank you. We'll take out the check.
Appreciate that. I have a motion moved by Councillor Wheeldon, seconded by Councillor Wright. The council received the delegation from Jimmy McLean, Gift from the Heart Community Engagement Liaison, Gift from the Heart update on number of Brighton residents using services provided at GFTH Outreach Dental Clinic and on the GFTH Amazing Race. Questions or comments on the motion? Councillor Wright.
Actually, I would like to ask just one question, if that's okay. I just wanted to know, do you have an actual number of Brighton residents that use the program?
We do, we can provide that.
Would you, Bev
Mind-
or Jimmy, would you mind please coming to the microphone for the answer? The people on YouTube can't hear you answer if you're not into the microphone.
Thank you for asking that question. Yes, we do have stats on that. I didn't provide them specifically just for Brighton, but I believe because our outreach center has been here longer in Brighton than it has been operational in Belleville, that it's about 42% of the people that we saw in those numbers that is just specific for Brighton. We're doing a lot of Provora treatments right now. And that's just where I just came from across the street, was that has really ramped up here in this area.
Thank you. Any other questions before Bev leaves the microphone? Thank you very much.
You're welcome.
All those in favor of the motion? Are there any opposed? Motion's carried.